Health officials have just confirmed the first measles case in Grand County, Utah, an unvaccinated teenager who was exposed outside the county. With cases also reported last month in Washington County, measles is once again making headlines. So what's happening in Utah? How dangerous is measles really? And what can families do to protect themselves? Let's break it down. Before we dive in, hit subscribe to stay ahead on health news that impacts your community. The Southeast Utah Health Department confirmed the new case on Saturday. The patient is under 18, unvaccinated, and likely exposed outside the county. Fortunately, officials say no exposures have been reported in schools. Right now, health teams are doing contact tracing. That means identifying anyone who may have been in close contact and alerting them about possible risks. Measles usually starts 7 to 14 days after exposure. Symptoms include and finally, a rash that starts on the face and spreads downward. If you're unvaccinated and develop these symptoms, health officials say, call your doctor before going in so they can prepare to protect other patients. Measles isn't just a childhood rash. It's highly contagious, one of the most infectious viruses known. If one person has measles, up to 90% of nearby unvaccinated people will catch it. Complications can include pneumonia, brain swelling, and even death, especially in young children. That's why even a single case sparks concern. This case in Grand County comes just weeks after 2 school-aged children in Washington County tested positive in August. Schools were notified, and unvaccinated students exposed were asked to stay home for 21 days, the length of measles incubation period. That shows how quickly measles can disrupt communities, schools, businesses, and families. The best protection is the MMR vaccine, measles, mumps, and rubella. Health officials call it safe and highly effective with lifelong protection for most people. Unvaccinated children are especially at risk, and when vaccination rates dip, outbreaks return. That's exactly what we're seeing now. In Grand County, public health teams are conducting contact tracing, alerting families of potential exposures, monitoring local clinics for suspected cases. So far, no exposures have been linked to schools, but officials warn that measles spreads fast in public spaces like churches, markets, or even waiting rooms. Here's what you can do. Check your vaccination status. Make sure you and your kids have the MMR shots. Watch for symptoms: fever, cough, and rash. Don't ignore them. Call before visiting clinics if you suspect measles to protect others. And remember, protecting yourself also protects newborns, people with weak immune systems, and others who can't be vaccinated. So here's the takeaway. Measles is back in Utah. It's rare but dangerous. The good news? It's preventable with a simple vaccine that's been protecting families for decades. If you found this helpful, hit like and subscribe for more clear updates on health and safety. And let me know in the comments. Do you think schools should require MMR vaccines to stop outbreaks before they start?